Hi, my name's Tammy Gaines, and today is the 25th of February, 2019. We are in Nursing 2, and I will be talking to you about Crohn's disease. So, Crohn's disease does not have an underlying cause, or at least not one that's definitive right now. However, the experts are leaning towards the cause being more like an autoimmune disorder. It's also considered to have genetic components because people are seeing it go from parent to child, and they're also seeing it be affected by some environmental factors. A lot of people are saying things like GMOs and how we grow our food is affecting the GI tract and causing some of these diseases, but it's not necessarily proven right now. The pathophysiology of Crohn's is an inflammation and ulcers. And in Crohn's, unlike any other disease of the GI tract, it can produce itself in any portion of the GI tract. That means it can run from anywhere from the mouth to the anus. However, the most common affected areas are the distal end of the small intestine, the cecum, and the colon, the entire portion. And it can affect any and all layers of the tissue. In Crohn's, segments of the GI tract become inflamed, and in the early stages of the disease, these segments can be varied. But over time, they start consolidating into rows, and they start to form what leads to like a cobblestone appearance. Over an extended amount of time, the growths can lead to obstructions and abscesses, which often necessitate a surgical intervention. Inflammation can also cause excoriated tissue to become and develop a fistula, which often leads to sepsis if it opens into the abdomen, and it also requires surgical intervention. Often they're on the outside and can be seen on the exterior of the body. When the GI tract, especially the small intestine, is ulcerated or inflamed, absorption of nutrients is impaired, which will cause malnutrition and issues for the patient. Some of the symptoms of Crohn's disease do overlap with many other GI disorders. These include nausea, vomiting, diarrhea, fatigue, and abdominal pain. It's very often in the right lower quadrant, but it can be anywhere in the abdomen. Some additional symptoms are fever because of the inflammatory process and rash. The rash can often be attributed to the disease itself since it is autoimmune in nature, but it also could be from medications or treatments or comorbidities that are caused by the disease or in conjunction with the disease in that patient. As the disease progresses, the patient can experience weight loss related to poor absorption of the nutrients, and this can actually lead to severe malnutrition. Dehydration from diarrhea is common in Crohn's, and the patient can also experience an electrolyte imbalance because of it. It's also very important to watch out for anemia because it can be anywhere from lack of intrinsic factor or just poor absorption, and this is often managed through medication and injections. The nurse plays a really important role in the care of the Crohn's patient. During his or her assessment, the patient is going to report symptoms that can clue the nurse in what the disease process is taking place, especially if that patient is seeking a diagnosis or even determine how the disease has progressed in a chronic patient that's already been diagnosed. Taking and monitoring the patient's vital signs and being sure to specifically pay attention to the temperature changes is really important. Additionally, when assisting the patient with toileting, noting the qualities of the bowel movement is essential. Fatty deposits are common in some Crohn's patients, especially when it's in the higher up in the small intestine. And the nurse is responsible for listening to bowel sounds as well as knowing the signs of a bowel obstruction, such as hyperactive bowel sounds in one area and then diminished areas below what would be the obstruction. This is important because stools during an obstruction are often mistaken as diarrhea. It's also very imperative for the nurse to establish open and safe communication with the patient so that he or she can feel comfortable sharing that really sensitive and pertinent information about his or her signs and symptoms, which can often be really sensitive for them or upsetting for them to share, especially with someone who they consider to be a stranger. The preferred method for testing for Crohn's is actually the small bowel barium enema because it's able to divine mucosal abnormalities, especially that cobblestoning effect of the mucosa. However, colonoscopy is the most definitive test, which helps to differentiate Crohn's from any other disease process in the colonoscopy. During the colonoscopy, the physician will take biopsies, and then he's able to determine if there are any cancerous lesions and further on the patient's treatment. Occasionally, it's appropriate for the capsule endoscopy, which is a camera the size of what would be a large vitamin, and it's able to take multiple pictures of the GI tract once it's swallowed and as it passes through the entire GI tract. Another common test for the Crohn's patient is blood tests, and this is mainly to rule out any problems with anemia or any bleeding problems. Medical management for the Crohn's patient is pretty individualized. This is mainly due to age or severity of the disease and any complications that are going to arise from the Crohn's or any other disease process that is present in the patient. Many medications are available to use in the treatment, but what's most important to understand is that the physicians were going to treat this disease with multi-medication and kind of in a pyramid style where they'll use one and then add on and then add on and add on. They'll often start with anti-inflammatory medications and a steroid, and if that does not curb the effects of the disease, they'll often add a medication that's going to weaken or modify the body's immune response. Often this is going to be your immunosuppressant drugs or your biologic response modifiers. They're often given on a trial and error basis, so if it works, they continue, and if it doesn't, they're going to try something new. And the treatment's going to change substantially if cancerous lesions are detected. Then they're going to go through the process to solve that problem. The patients could also be going through a flare, and they're going to treat that if necessary. Any other complications often arise, such as anemia or obstructions or fistulas, and then that's going to derail the treatment in that direction. Most patients will find themselves on the physician's operating table. Unfortunately, that number looks like it's about 75%. Some common surgeries are a strictureplasty, and that's to fix those obstructions to enlarge in that area so that the GI can function normally. Colonostomies to repair portions or remove portions of diseased bowels or fistula repairs. Occasionally, the Crohn's patient can find themselves in emergency surgery, and that's usually if they've experienced some kind of perforation or a fistula in the portion of the GI tract. Often the most common symptom that the patient's going to see is the bleeding or the fever, and if it's not taken care of properly or quickly, it can lead to sepsis and actually kill your patient. The interventions that the nurse will perform are to help the patient maintain their nutrition status, either through prescribed diet or maybe through TPN, depending upon how their treatment is going. The diet for the patient after surgery or flare may start at that TPN, which is going to have to be weaned off. Then it becomes low residue, high protein to facilitate healing and calorie control, or high calorie to control weight. It's really important to maintain fluid balance because diarrhea often causes dehydration, and the nurse will often monitor intake and output as well as perform pericare to keep that skin down there intact and healthy. It may even be necessary to administer a sitz bath to comfort the patient, and often the patient will become anemic with this disease, and then it's going to be the nurse's responsibility to administer B12 or even iron injections. With the iron injections, it's important to use the D-track method, and this is going to prevent skin staining. Also, arguably the most important aspect of the nursing intervention is that effective patient teaching and support, which is going to aid that patient in healing and coping with their disease process. Some really common teaching aspects is going to be how that chronic diarrhea is going to affect their nutrition status. Also, coping skills that can affect the success of their disease and their care plan, and the importance of finding some groups that are going to help support them and teach healthy coping skills. Also, effective self-care and disease education. Also, the need for medical compliance will also be taught because it can help them be successful with their care plan. And it's going to be tailored to the specific patient to assist them in managing their medications and their treatment. The nurse will also teach the patient about the specific signs and symptoms to look for, especially when to contact the doctor to get help and get an intervention if necessary. Unfortunately, Crohn's is a chronic disorder that doesn't have a cure, and while most medicines are going to help, there's no combination that can even bring you close to a cure. While the disease has a high reoccurrence rate, the best outcomes are often obtained by following that care plan basically to the T and seeking care when the patient is experiencing symptoms that are not their normal.